This discussion is going to focus on various aspects of therapeutic electrical current. So some of the things we've actually already talked about in the lab will come up here. This discussion is an overview, kind of all of the things that encompass therapeutic electrical current, including just some basic electricity principles. So as I've gone through the textbook, I kind of pulled out some of the specific things about general electricity that you should know. If you're looking at the notes, there may be some slides that are not in this discussion. I did go through even my previous notes and took some things out. So I really tried to narrow it down to the general electricity stuff that I feel is the most important for you to know. So an overview of what we're going to be looking at, again, as I said, there are some general electricity things that you need to know. So terminology is really important. So you need to make sure as we're going through these videos and what we talk about in class that you kind of get the terminology straight. And again, like I said, as far as the basic electrical principles, I did try to take out what I think is are the more important things that at least a functioning clinician should know. As we get into the clinical application, really important, and some of that stuff will tie into as far as your therapeutic goals and what structures you're looking to affect. So we'll see when we talk about the basic principles of electricity, you'll get to see how it's going to impact the body based upon some of the different characteristics of the individual waveforms. So that's going to be when we look at our treatment goals, how that's going to impact that, whether, as we're looking at the different types of effects that we're going to be examining. The other thing that this is going to be important for, again, even though it seems like it's a little ways off, but it's going to be important to kind of make you a little bit more of a savvy consumer as it relates to purchasing electrical stimulation units, because obviously there are various types of units that offer different types of waveforms and things of that nature, so that when you go to purchase, you're able to look at what it is you're really going to need in order to do therapy for your patients. So when we look at electricity, you basically have two broad types of electrical current. You have static and you have current electricity. So static electricity is, again, commonly what you see, you rub two surfaces together and that creates a small amount of electricity based upon the friction between two surfaces rubbing together. Current electricity is what we're going to be dealing with. And if you look on the picture here, you can see our three basic types of current electricity. So you have direct current, alternating current, and pulse current. So these are the current types that we're going to be drawing from to create our therapeutic electrical current. And in most cases, the type of electrical current we're going to be utilizing is the modulated current, which is the pulsed current. There will be one example of direct current that we will be using, and a few of the currents will kind of emanate or come off of the pure alternating current, albeit they won't be just a pure alternating current. But again, the majority of them will come from the pulse. But we'll talk about all of the different types and where they fit, and you'll see pictures similar to this. We're going to talk about different current shapes and things like that that all kind of affect what you get out of the current therapeutically. So looking at polarity as it relates to electrical stimulation, the terminals are what come out of the electrical stimulation units, and that's where you're getting your output. So this is going to be what you're attaching to the patient with your electrodes, and you'll have both a positive and negative lead. Okay, so if you remember from lab, we have two leads on each channel. One's positive, one's negative. Positive is the anode, and the negative is the cathode. Now, as far as pad placement and the charges are concerned, for a lot of the treatments we're going to do, the positive and negative doesn't really matter, other than you need both a positive and negative in order to complete the circuit. There are instances where, depending upon the type of waveforms you use, where placement of the positive and negative will matter. And the basic reason for that is when you look at how electrical charges work and positive and negative leads operate, the like repel and the opposites attract. So if you want, in order to get the advantage of a positive or negative charged ion, you have to look at whether you want to either attract or repel. So again, like repels like. So in other words, on the positive lead, it will repel anything with a positive charge, or it will push it away, whereas it will attract negative. Okay, so it's kind of like the two ends of a magnet. In order to get the two ends of a magnet to stick, you have to put the opposite, the positive and negative poles together. If you try putting the positive with the positive and the negative with the negative, when you're talking magnets, they'll push each other away. It's the same concept when you're looking at electrical current. So we'll talk about the instances where that matters and how you'll look to do that in your application. So when we look at some of the basic science behind just electrical currents in general, these are some of the just terminology and kind of relationships that I kind of want you to know and understand. So the electrical current flow, there's two main factors that impact that. One is the force of the electrical current, or the voltage, and the other is the resistance to that force, which is the ohm. Okay, and when we look at Ohm's law, because this is what dictates the rate of current flow, which is the ampere, so the A is an ampere, is equal to the voltage divided by the resistance, or the ohm. So there's an inverse relationship there. So the greater the resistance, the greater the force has to be to have a certain rate of electron flow. So the resistance looks at what kind of limits the flow of the electrical current, and that's going to impact the overall rate. Okay, so again, note those terms and the relationship between the two. So the inverse relationship between the voltage and the ohm, or the resistance, and that impacts the rate of electron flow. Current flow, or the flow of electrons, goes from an area of high concentration to the area of low concentration. So in other words, when you have an electrical current moving, it's basically the movement of electrons. So they move from an area of high concentration to an area of low concentration, which then that's going to create an electrical charge. Now the direction of the electrical charge moves from the positive pole to the negative pole. So again, you have to understand the difference between those two directions. So when you're talking the flow of electrons, area of high concentration to area of low concentration. When you're talking the direction of the electrical current, it moves from the positive to the negative pole. So when we look at the actual medical devices used to deliver therapeutic electrical current, again, primarily we have two main types. We have neuromuscular electrical stimulators, which are used to generate a muscle contraction, and we have transcutaneous electrical nerve stimulators, which are sensory based. So, and again, we have treatment goals based upon those two functions, whether it be for pain relief or to possibly strengthen or get the muscle to contract. Which is going to have to be manipulated by the different parameters we're going to be talking about. They all have positive and negative leads, okay, as we had discussed, and the reason for that is that's what's going to allow you to create an electrical current. You need to have both a positive and negative terminal attached to the patient in order for that to work. And as I said earlier, we have three currents that we described previously. Two of them are pure currents. We have a direct current and an alternating current, and then we have one modulated, which is pulse. So again, our therapeutic currents are going to be derived from those. Most of them are some form of a modulated current as it relates to what we're going to be applying. So now as we kind of progress and get into some of our different terminology, so as it relates to alternating current, so if we look on the screen here, you can use the picture as a reference. An impulse is the flow of alternating current in a single direction. So if you look at the picture here, all these pictures to reference, so there's always going to be a positive and negative pole here. So the positive, look at that as being the top of the line, and the negative being the bottom. Okay, so you have your current flow, you have your intensity, which is basically how high off the isoelectric or zero line is. So as you see with that first picture, we have an impulse, and that's in the positive direction, right? And it's flowing in one single direction. A cycle is basically two impulses. So if you look at the cycle, you have two impulses, one positive, one negative. And then you have your frequency, which is the rate per second. Okay, so, and that's, again, in frequency setting is going to be something that you're going to be utilizing with the different waveforms that we utilize. So here we have impulse, cycle, and frequency. Again, impulse is the flow of alternating current in a single direction. A cycle is two impulses, and the frequency is the rate, or how many pulses you have per second. Again, looking at our output characteristics. So again, these are the three basic forms that we have. They were all pictured in the beginning. Your direct current, or your DC, is a continuous flow in one direction. So when you look at the top there, you see, again, on top of the line, so this would be a positive DC current if we were to describe this. And it's a continuous flow. There's no interruptions in the current flow. Clinically, we're only going to be talking about one type of direct current. Our ionophoresis is the only direct current that we're going to be utilizing. So when you apply ionophoresis, which is applying the electrical stimulation to drive a medication through the skin, that is DC. Okay, and that's the only form of DC that we're going to be using. And in order for a current to be DC, it has to be one continuous flow. The pulsed current is the modulated current. Many of the currents we're going to describe are going to be a version of that. So the pulse current is when you have an interrupted flow of electrons. And the alternating current, which you have at the bottom, is another continuous flow, but it varies between the positive and negative poles. So as you look at that picture, the picture on the bottom, you have a continuous flow, but it alternates. So unlike the DC, which stays all in one direction, the alternating current alternates between the positive and the negative poles.